We're in Berlin with Ella Watson-Stryker, who's one of the best-known faces at the moment of the medical charity Médecins Sans Frontières. Ella had no idea what she was getting herself into when she received a call last year asking if she could fly to Guinea to work on a health emergency. It turned out to be Ebola. No one would have blamed her for flying straight back home, but she chose to keep on going. This month, her organisation, MSF, hit the headlines again, this time when their hospital in Kunduz in Afghanistan was bombed by military aircraft belonging to the US government. 22 people, doctors, nurses and patients died in the attack. For people like Ella, who are used to putting themselves in danger, it was a betrayal.
When I heard that our hospital in Kunduz had been bombed, I was actually at a friend's wedding in Virginia. It was a camping wedding, so we'd gone the night before, and I woke up Saturday morning and was reading the news and saw that the hospital had been bombed. The first thought that I had is that my country bombed my colleagues. I'm an American citizen, and it was an American plane that dropped bombs on our hospital. I haven't worked in Kunduz, but I have friends who worked there. We know that we're working in conflict zones. We're very aware of that, but we don't think that American bombs are what we have to worry about. I can't imagine what my colleagues in Kunduz experienced. I think if you've been in an earthquake, you know that 30 seconds of an earthquake seems like a very, very long time, and it's very terrifying. To have bombs continue to fall for more than 30 minutes, the total bombing was an hour. It must have felt like days to the staff on the ground.
Does the bombing make you nervous now about going into war zones?
One of the worst aspects of the work I do is I know it puts a lot of stress on my family. And so that's probably one of the biggest deciding factors, is how much they will worry and what impact it has on them.
MSF operates in war zones, but recently it has decided it needs to work in Europe too, providing search and rescue boats to the thousands of refugees who are making dangerous journeys across the sea to reach here. There are some 40 million displaced people in the world today, and many of them are coming to Europe. At least 350,000 people have crossed into Europe this year, and Germany alone is expecting some 1 million refugees. I asked Ella whether European hospitals would be able to cope.
I think the good thing is that European public health systems are the best in the world. They have resources, they have staff, and they're really able to respond to an increased demand. And what we're seeing is that a lot of the people who are trying to make this journey they have temporary health problems that are caused by the journey itself. We'll see people who have scabies, for example, from being in crowded, unsanitary conditions. Some of the people who are coming on boats are being exposed to fuel and gasoline that causes skin burns. And then you see people who have chronic malnutrition. And one of the biggest problems is the mental health problem. So a lot of people are coming from areas where they've been traumatized because they're fleeing conflict, and then they're often further traumatized on the journey itself. I think really the mental health component is the part that's different, and the other health needs are really the same that humans experience all over the world.
Going back to Ebola, some 11,000 people have died from the most recent outbreak. I asked Ella, who has seen the problems up close, whether we could learn anything from the crisis.
I think one of the lessons learned from the Ebola outbreak is that we were much too slow. We responded too late, and as humanitarian aid workers, we failed to stop the outbreak. I think another lesson learned is that you can't respond to a massive outbreak that is covering multiple countries without strong leadership and coordination, and that was really lacking. We looked to the World Health Organization, we looked to the United Nations for leadership, and it wasn't there. It was the first time that there was an Ebola outbreak in Guinea, Sierra Leone, and Liberia. And so the countries, the ministries of health didn't have the technical capacity that they needed to respond. There needed to be leadership and technical advice coming from other entities. The uniqueness of Ebola, the graphic nature in which it's depicted in the media, I think really, really drove home the point that there are really no borders. People are going to move and they will bring viruses with them. And so we have to act quickly. It's not that we need to be afraid of people coming from outside, it's that we need to recognize that human illness anywhere is a threat to everyone.